Greetings. We're going to have a quick chat with Dr. Barbara Wilson, who's working in the veterinary industry and has worked in private practice and is part of our Integrative veterinary group. We're going to have a chat about how integrative medicine can fill the gap in veterinary care. Hi Barbara, would you like to introduce yourself?
Yes, thanks, Wayne. I'm from Brisbane. I graduated from vet about 50 years ago, so my practice days 1974 from Queensland Uni.
A little bit more than me. I was an 81. Yeah.
So things were different in those times, and I guess that's what I want to talk about now. I've been doing work in recent years with businesses in agriculture and their animals rather than practice, and it's clear to me that there's a lot happening in business that isn't happening in veterinary practice to help get the patients what they want, but also the clients what they want. And that's where the integrative medicine comes in. It's got so much to offer, but I've noticed going around not many practices are using it.
So the clients that you're working with right now, are they focusing on nutrition care, supplements?
Well, they want to have a lifetime plan for their animal and that they can work with the animal on, and then hopefully not too many visits to the vet. So they like preventative strategy. They like to know what they're doing with their animal. They like to treat their animals individually, and they will tell you lots of things about their animal that you won't notice in the consult room. And I think the holistic approach that integrative medicine offers is ideal for that, and it fits the client's needs, but it gives you so much more options as a practitioner when you get these cases where the first solution that you apply doesn't seem to do much.
Is it necessarily related to drug therapy?
Well, I think that the preference is not to go there, first of all, is to make sure that whatever you're doing in veterinary practice, that you're supporting the animal to help it heal itself. And then after you've intervened, e.g. with surgery, that you've got a strategy in place that will support the animal beyond that intervention, because I think that's another opportunity. If you put all this work and investment into a piece of surgery or some stretch of therapy, there's got to be ongoing care, and that's where an educated owner that uses referrals perhaps to integrative medicine practitioners who can follow on, that gives you a much better result.
And what sort of therapies are we talking about when we mention integrative?
Well, there's a good range. There's everything from acupuncture to Western herbal medicine or even herbal medicines. There's a whole range of physical related therapies that you can do. Diet is extremely important, probably the best place to start. Nutrition, balanced nutrition, and then even aspects such as behaviour and relationship training between the animal and the owner, so that whatever good you're doing can be reinforced constantly when the animal's at home and has left the clinic.
That sounds really ideal, but given that the veterinary course is very full on and probably doesn't include some of these therapies, how do you think we could get to our newer graduates or even our old-timer graduates to add these things?
Well, I think it's a team approach. I think if you look at what you're doing as a team approach and take advantage of the others around you, help you do your work as a vet. And some of the owners I find are very helpful too. For example, there are some fairly large Facebook groups now where vets can start those, and clients can keep in touch via that. I think you have to extend your knowledge, but you also have to be prepared to delegate some of that responsibility to others in a team approach.
Yeah, thanks for that. We'll talk a bit more about this later. Thanks for your time.
Welcome.